Let's talk about being healthy. What does that word even mean to you? For most of us, it's pretty simple. You're not sick. But what if that's only a tiny piece of the puzzle? Today, we're diving into a much bigger, more complete idea called holistic health. It's all about seeing the entire picture of what it takes to be truly, deeply well. And honestly, it might just change how you think about everything.
So, here's our roadmap. First, we're going to challenge that old definition of health. Then we'll break down the 4 key pillars that really support our well-being. After that, we'll take a look at how doctors are using this in the real world. We'll untangle 2 words you hear all the time, well-being and wellness. And finally, we'll get into the practical stuff, the active steps you can take on your own journey.
All right, let's jump right in with the big question. What does it actually mean to be healthy? Like I said, most of us just think, well, I don't have the flu, so I must be healthy. But that's a really limited way of looking at it. We need to move beyond just the absence of disease.
I mean, really think about it for a second. Is that all there is to it? If you don't have a diagnosed illness, does that automatically mean you're thriving? For a long, long time, that was basically the medical world's definition. But it leaves out, well, pretty much everything else that makes life rich and meaningful.
And this is the game-changing idea. True health is about balance. It's about a sense of harmony that connects your body, your mind, your emotions, even your bigger sense of purpose in the world. It's a total shift from just fixing what's broken to actually nurturing the entire system as a whole.
Okay, so if health is this state of total balance, what are we actually balancing? Turns out we can break it down into 4 fundamental components, kind of like the building blocks for this whole new way of seeing things. You can think of your health as this intricate puzzle where these 4 pieces are always interacting. First, you've got the biomedical stuff, your genetics, your age, your lifestyle choices. Then there's the ecological, the actual environment you live in, the air you breathe. Next is the psychosocial, your relationships, your job, your community. And finally, the spiritual piece, your sense of meaning, your inner peace. You see how they're all tangled together? A problem in one area, like a toxic work environment, is absolutely going to affect the others, like your physical body. It's all connected.
So this sounds great in theory, right? But what does it actually look like when you walk into a doctor's office? How does this holistic view change things in the real world? Let's take a look.
And let's be super clear, this isn't some fuzzy, abstract idea. It's a really practical approach. When a doctor takes a holistic view, they're not throwing science out the window. If anything, they're upgrading it. They're using a more complete blueprint to find solutions that work for the whole person, not just a list of symptoms. So, a doctor thinking this way is going to dig a lot deeper. They're not just looking at your sore throat. They're connecting the dots between all your body's systems, your family history, your environment, and, this is a big one, your own attitude and beliefs about your health. They're not just treating a disease, they're treating you. And what this does is completely transform the doctor-patient relationship. It moves from being this kind of mechanical, one-size-fits-all interaction to a real partnership. The focus shifts to you as a unique individual. And the goal, it's not just to treat what's wrong right now, but to actually prevent things from going wrong in the future. All right, let's switch gears just a little. You hear these 2 words thrown around all the time. Well-being and wellness. A lot of people use them like they mean the same thing, but there's actually a really important difference. So let's clear that up. First up, well-being. The easiest way to think about this is that well-being is the state of being healthy. It's the what. It's the overall condition you're in, including all those dimensions we just talked about: physical, mental, social, and spiritual. It's the destination, so to speak. And your well-being has 2 sides to it. There's the subjective part, that's your personal take. How happy are you? How do you feel about your life? We call that your quality of life. And then there's the objective part, the external stuff that can be measured, like your income or education. And that's your standard of living. Okay, so if well-being is the what, the state you're in, then wellness is the how. Wellness is the active process of trying to get to that state of well-being. It's not something you have, it's something you do. It's the journey itself. And that's the absolute key. Wellness is a verb. It's about action. It's about you actively participating in your own health. It requires continuous effort and really a positive, proactive mindset. It's about showing up for yourself day in and day out. So this brings us to the final and I think most empowering part. If wellness is an active path, where do you even start walking? Well, we can break it down into 6 key dimensions where you can really focus your efforts. And here they are. As we go through them, just think about your own life. First, physical. Are you moving your body and fueling it well? Emotional. Are you aware of your feelings and can you cope with challenges? Intellectual. Are you staying curious and learning new things? Social. Are you connecting with others and building strong relationships? Occupational. Do you get a sense of satisfaction and purpose from what you do every day? And finally, spiritual. Are you connecting to something bigger than yourself?
And that right there is the big takeaway. Wellness isn't a finish line you cross one day. It's not a destination you finally arrive at. It's an ongoing journey. It's about constantly making small, positive choices across all these different areas of your life.
So, as we wrap up, I just want to leave you with one simple question. Looking at those 6 dimensions, which one is calling to you right now? Where could you take just one small active step today? Which part of your health will you decide to focus on first? Thanks for digging into all this with me today.